Good morning. This morning we deal with the whole issue of healthcare again. This time the ongoing healthcare debate between conventional medicine and Ayurvedic medicine or traditional medicine with the incoming of both giants like China and India and of late Indonesia. Now let's look at conventional medicine at first, which is regulated, which is a multi-trillion dollar industry in itself. But before any pharmaceutical drugs hit the shelves and before it's prescribed, it goes through a wide range of research, outcome research again, and of course there's a lot of marketing being done, reviews being done, peer reviews being done, and before approvals are given by the regulating authorities. And no pharmaceutical drugs hits the stand for sale or is prescribed unless it goes through this rigorous evidence-based or data-based research findings, etc. And this is why we say that it's a multi-trillion dollar drug or pharmaceutical industry product. So basically, as a consumer or as a patient, you have a situation where if you have a medical condition, we usually go and see a doctor. A doctor reviews you, examines you, he checks with you, and after he has done the medical examinations, he will then prescribe to you after having a conversation with you regarding whether you have any allergies pertaining to that particular drug. Then based on your medical condition, he will prescribe over a period of time certain drugs for you to take with strict instructions. And he will review that. And if there's any side effects, he will review that again also. So it is highly regulated. It is prescribed by a medical doctor. The product that has been given to you has got data, it is evidence-based, and so forth. And then you have got stakeholders who are monitoring, enforcing, and making sure that there is no malpractice or medical negligence, and so forth. But if you look at the Ayurvedic industry itself, which is a multi-billion dollar industry now, because, like I said earlier, because of China and India, and also now Indonesia with their sexual products and so forth, you have a situation which is becoming very clouded because most of the products that are coming out from China, India, and also Indonesia have not had data compiled on it. It is not evidence-based, and it is coming into many countries. It's been advertised by many people without research, without evidence. And most importantly, those who are prescribing them are doing it under the platform of direct selling or through other business mediums without going through the regulatory agencies of government. So you have a particular product that is coming out and being sold and being marketed where they use actors, actresses, sometimes retired doctors and others. It is entirely a business operation. And sometimes they have it in a multi-tier direct selling platform. So by word of mouth, by marketing strategies, this is also catching huge market in the country, and TV stations are now basically advertising this. And the fear that has been brought to us is, who is regulating? Who is monitoring it? Does it mean that if it's herbal, it will have no side effects? That one particular Ayurvedic drug that is given to you, it will be a cure-all, the way it's represented. It's not cheap, it is expensive. But the most important thing is, who is regulating it? Why are they using, actors and actresses and people like that to market? When will third parties, the stakeholders or the government put their foot down and say, before there's any advertisements of any products, irrespective whether it's cosmetics, whether it's coming in as vitamins or supplements or whatsoever, it has to go through a rigorous process for us to monitor, check, verify before it is allowed. It has not been done today. So this morning's appeal by me is as a response to my colleagues, my learned colleagues in the healthcare industry in both situations, conventional and also from the Ayurvedic industry, that the time has come for Malaysia to strictly monitor, enforce and look at every product that is being used as a marketing through our TV stations. We must make sure that our consumers are not consuming something just because it is Ayurvedic and it's herbal based, it's got no chemicals, and it's a one-all tablet for a cure-all situation, that it should be allowed to flood our market. The time has come for us to put a stop to this. And this morning, I'm appealing to the Minister of Health. I'm also appealing to the Director General of Health and the other agencies, especially my friends in the Pharmaceutical Division of the Ministry of Health and the Enforcement Division. Let's work together and let's look at this issue and make sure that there are no supplements, no vitamins which are coming from this particular industry that is flooding the market, which will cause major issues. Because it has caused major issues. We had many issues where it has come up, which has caused great ailment and sometimes alleged even fatalities. And of course, the hurting of our organs. So this is why this morning's critical call is going out to ask us that the time is right for us to regulate the Ayurvedic industry in this country so that it will not cause any more harm. Thank you.